Hi, my name is Santiago Estevez and I am ENT at the Hospital of Salamanca, Spain. This work, called When and Why to Withdraw Riluzole, has been carried out in the care unit for patients with amyotrophic lateral sclerosis of the University Hospital of Salamanca in Spain. This unit is made up for a multidisciplinary team that includes neurologists, pneumologists, specialists in palliative care, and endocrinologists, among other professionals. The main objective of this study is to describe the main causes in the discontinuation of treatment with riluzole. As is well known, riluzole is one of the few drugs available for the treatment of amyotrophic lateral sclerosis. It is possibly the most widely used drug and it is authorized in many countries. In our setting, it is the drugs used to treat this kind of patients. The evidence of the efficacy of riluzole is determined by the results of two randomized multicentric studies in which an increase in survival at 12 months and a lower need for tracheotomy were described. In other studies, it's shown that the effect of the riluzole occurs in advanced stages of the disease, which could justify the treatment discontinuation by some patients, given that riluzole could affect their quality of life. In this study, a cross-sectional descriptive approach was carried out. The sample of the study was the total number of patients in follow-up by the unit at the time of the study, who were asked about the adherence and medication side effects of the treatment. "39 patients were included. 14 patients indicated that they had withdrawn the treatment with riluzole, and it represents the 36% of all the patients. The reasons more frequently described for the discontinuation of the treatment were spasticity and gastrointestinal tolerance problems, with the patients referring dyspepsia as the main topic. It stands out that only one patient referred having stopped the treatment because it was ineffective. No significant data was found on the moment in which the patient decides to suspend treatment. For all, we can say that 1/3 of our patients stopped taking riluzole and 80% of them were due to side effects that reduce their quality of life. The effects described differ slightly from those described in the riluzole technical datasets, in which the most frequent effects are nausea, asthenia, followed by headache and diarrhea. We can conclude that riluzole is one of the few weapons we have against amyotrophic lateral sclerosis, and that 1/3 of the patients in our studies discontinued treatment, being the side effects the main cause of discontinuation. The most frequently side effects described were spasticity and dyspepsia. The absence of response to treatment does not seem to be a frequent reason when the patients decide to withdraw treatment. Thank you for your attention.